When is myringotomy needed for a child's ear infection? Imagine your child's ear hurting so much they can't sleep or focus. Sometimes, ear infections can become stubborn, and that's when doctors consider a procedure called myringotomy. This is a small surgery where a doctor makes a tiny cut in the eardrum to drain fluid and relieving pressure. It is often done along with placing tiny tubes called tympanostomy tubes to help keep the ear ventilated and prevent more infections. Myringotomy is usually recommended for children who have frequent or long-lasting ear infections that don't get better with medicine. If a child has 3 or more documented ear infections within 6 months, or more in a year with at least 1 in the last 6 months, doctors may suggest this procedure. It's also considered when fluid stays in the middle ear for 3 months or longer, which is called chronic otitis media with effusion. This can cause hearing problems, balance issues, or behavioral changes, especially if the fluid remains for more than 3 to 4 months. Persistent hearing loss caused by fluid buildup is another reason for considering myringotomy. If a child's hearing impairment lasts beyond a few months, it can affect speech and learning, so intervention might be needed. The procedure is also recommended if complications develop from ear infections, such as facial nerve paralysis, mastoiditis, meningitis, or even brain abscess. Children with certain conditions like cleft palate, developmental delays, or weakened immune systems are at higher risk for persistent or complicated infections, so doctors might suggest surgery sooner. During the procedure, a small incision is made in the eardrum to drain the fluid. Usually, a tiny tube is inserted to keep the opening open, allowing air to flow and fluid to drain out naturally. These tubes stay in place for about 6 to 18 months and often fall out on their own once the ear heals. In some rare cases, especially in very young babies or when the eardrum is too inflamed, doctors might perform myringotomy without placing tubes. Most of the time, myringotomy is done under general anesthesia in a hospital or surgical center. It is a common and safe procedure for children, helping to reduce the frequency of ear infections and improve hearing. It is most often recommended for children between 1 and 3 years old because, by age 5, the tubes in the eustachian tube, which connects the middle ear to the throat, usually develop enough to help drain fluid naturally. If your child has recurring ear infections or persistent fluid buildup, it's important to talk with an ear, nose, and throat specialist. They can evaluate your child's specific situation and determine if myringotomy and tube placement are the best options. Remember, every child is different, and treatment decisions should always be made with a healthcare professional's guidance. This procedure, when used appropriately, can greatly improve your child's comfort, hearing, and overall health.